Did you know that 1 out of every 2 seniors suffers from the pain of arthritis in the United States? That number jumps to 48% for people over 65. And if you are a woman, the risk is even higher, reaching up to 79%. That's right, nearly 8 out of 10 moms, grandmothers, or beloved women around you are quietly battling constant nagging pain every single day. What an even more concerning is that arthritis isn't just about aches and stiffness. It's actually the #1 cause of disability among older adults. But this isn't a video meant to make you worry more. This is a video to help you take back control of your life. We will share practical, effective solutions you can use right at home today. I'm going to reveal the most natural, science-backed methods to help you or your loved ones ease the pain safely and effectively, without relying on painkillers or surgery. Are you ready to bring joy back into your life and say goodbye to those stubborn aches and pains? You probably heard the old saying, but to defeat your enemy, you must first understand it. Arthritis is that an enemy you need to understand clearly. According to research from Health Canada, osteoarthritis is the most common form of arthritis. It's caused by the gradual wearing away of the cartilage between joints over time. The joints most affected are the knees, hips, spine, and feet, places that carry your body weight every day. Meanwhile, rheumatoid arthritis is an autoimmune disease, where the immune system mistakenly attacks healthy joints, causing intense inflammation and pain, especially in smaller joints like the fingers and toes. Let me tell you about John Dow's 72-year-old grandfather living in New York. He used to be active, enjoying morning walks with his grandkids. But then, the dull, persistent pain of osteoarthritis in his knees made it harder and harder for him to move. After a fall, John decided to learn everything he could about his condition and started trying at-home methods to manage his arthritis. It was only after truly understanding his illness that John could choose the right strategies to ease the pain and stay independent. Would you like to know what John did to improve his life? Stay with me, because in the next part I will reveal one of the simplest yet surprisingly effective methods, hot and cold therapy, you can do right at home. Ever wonder how something as simple as heat or cold can relieve arthritis pains so effectively? This isn't just an old wives' tale, it's a well-researched medical strategy. Heat therapy helps by relaxing and softening tissues while boosting circulation. It works by expanding blood vessels, which improves blood flow and relaxes tight muscles around the joints to ease pain and increase flexibility. You can apply heat by soaking in warm water at about 92 to 100 degrees Fahrenheit for around 20 minutes, or by using a warm towel, a moist heat pack, or a heating pad. It's important to limit each session to 20 minutes to prevent burns, especially for older adults with poor circulation. On the other hand, cold therapy is excellent for reducing inflammation and swelling, and it also helps numb pain. It works by narrowing the blood vessels and slowing circulation to inflamed areas, which helps reduce swelling and temporarily dulls pain. A good way to apply cold is by using an ice pack or a bag of frozen veggies wrapped in a towel on swollen or painful joints after activity. Each session should be limited to 15 to 20 minutes, as prolonged exposure can damage the skin and underlying tissue. You can also use a smart combination of both, which we can call the switch-up method for optimal relief. A suggested routine is to start your morning with heat therapy to loosen up and improve flexibility. Then, in the afternoon or evening after activity, you can apply cold if swelling or pain flares up. You can alternate both therapy throughout the day. Just be sure to space them out by a few hours. There are some very important safety tips to remember. Never place heat or cold directly on your skin. Always use a thin towel as a barrier. Keep sessions to 20 minutes or less to avoid skin and tissue damage. Seniors with poor circulation, diabetes, or reduced sensation should consult a doctor before trying this at home. The big benefits of hot-cold therapy are that it reduces swelling and pain after light activities, improves flexibility, and eases morning stiffness. making daily tasks much easier. Best of all, it requires no medication and is easy to do with simple household items. Emily Ian's story is living proof of this. Emily, 68, from Toronto, used to struggle each morning with stiff knees. She couldn't even bend down to tie her shoes. After trying 20 minutes of heat therapy in the morning, she noticed her joints felt looser and walking became much easier. On days she took 30-minute walks, Emily would follow up with a cold pack in the evening to reduce swelling, helping her sleep better and feel more refreshed the next day. Can you see the secret now? What if I told you that 2 everyday kitchen spices, the turmeric and ginger, are actually powerful natural remedies for arthritis pain, with effects comparable to anti-inflammatory drugs? It might sound surprising, but this is a science-backed truth you want to know. Turmeric is a powerful anti-inflammatory warrior thanks to its magic compound, curcumin. Curcumin has strong anti-inflammatory properties, and a study published by the Arthritis Foundation showed that 500 milligrams of curcumin daily can reduce inflammation as effectively as non-steroidal anti-inflammatory drugs, but with far fewer risks to the stomach and kidneys. In fact, a study in Italy found that 58% of arthritis patients experience significant pain relief and reduce stiffness after taking 500 milligrams of curcumin daily for just 90 days. To use it effectively, you can take a supplement with 500 to 1,000 milligrams of curcumin per day. For the best results, combine it with black pepper, which can boost curcumin absorption by up to 2,000%. Ginger may be even more effective than common painkillers. It not only blocks inflammation-causing compounds, but also contains powerful antioxidants that help protect joints. Research by Dr. Srivastava found that more than 75% of arthritis patients reported noticeable improvements in pain, swelling, and morning stiffness after just a few weeks of daily ginger use. A simple daily dosage is about 5 grams of fresh ginger or 1 teaspoon of ground ginger, which is easy to add to tea, soups, or everyday meals. Olivia Ann's story is about her golden morning tea routine. Olivia, 75, from London, had been concerned about the side effects of NSAIDs for years due to stomach issues. After talking with her daughter, she switched to drinking turmeric and ginger tea every morning. Within 3 weeks, she was pleasantly surprised to feel significant relief in her knees. Today, Olivia walks with much more ease and no longer depends on pain meds. Here are a few important tips. Be consistent and use turmeric and ginger daily for at least 3 to 4 weeks to notice real results. Stick to the recommended doses, because more isn't always better. And if you were already taking medications, be sure to consult your doctor before starting any new herbal routine. Nature has some amazing secrets. Thus to it, and we are not done yet. There are still more effective methods waiting for you to discover. Have you ever thought that complete rest is the best way to deal with joint pain? Many people once believed that, but in reality, it's quite the opposite. Science has shown that gentle, regular movement is actually one of the most powerful ways to reduce arthritis pain. The less you move, the more it hurts. When you stay still, your joints and muscles weaken over time, which leads to more stiffness and pain. On the other hand, gentle, regular exercise can strengthen the muscles around your joints to reduce pressure, loosen stiffness, increase flexibility, improve blood flow, reduce inflammation, and even boost your mood and heart health. Some of the best exercises for seniors with arthritis include swimming and water exercise. Research has found that water supports up to 90% of your body weight, allowing you to move freely without straining your joints. Just 45 minutes of swimming or water aerobics 3 times a week can greatly reduce pain and stiffness. Light walking is another powerful option, with recommendations suggesting just 30 minutes a day, 5 days a week, to maintain flexibility and ease pain. Gentle practices like yoga and tai chi have also been proven to significantly improve flexibility, balance, and chronic joint pain. There are also simple and effective home exercises you can do. Chair exercises are perfect for those with limited mobility. You can try gentle movements like leg lifts, wrist circles or slow stretches for 10 to 15 minutes a day while seated. Resistance bands are another great tool that are easy to use at home to help build muscle without needing a gym. Michael N's story is a journey back to life. Michael, a 73-year-old man from Sydney, could barely walk due to severe hip arthritis. At first, he was afraid that moving might make things worse, but with encouragement from his daughter, he began swimming gently at a nearby public pool. After 2 months of swimming 3 times a week, Michael not only walked more comfortably, but also felt more upbeat and hopeful. Today, he proudly joins community events without fear of pain holding him back. Here are a few important reminders. Always warm up before any exercise session. Choose exercises that match your physical condition and never push too hard. If possible, it's a good idea to check with your doctor or a physical therapist before starting a new routine. Are you ready to bring back flexibility and joy with every step? The next secret is even more powerful and even easier to try. Have you ever wondered why some older adults stay full of energy and rarely complain about joint pain, while others struggle daily with arthritis? The answer isn't just in genetics, often in what they eat every single day. The right diet doesn't just ease arthritis pain. It can help you feel younger from the inside out. According to health experts, eating anti-inflammatory foods regularly can make a real difference. You should eat more fatty fish rich in omega-3s like salmon and mackerel, dark leafy greens like spinach and kale, and berries like blueberries and strawberries. It's also beneficial to include nuts, olive oil, and green tea in your diet. At the same time, you should try to avoid processed foods, fast food, refined sugars, sweets, fried and greasy foods, and alcoholic beverages. Following the Mediterranean diet is like using nature's medicine. According to Northwestern Medicine, this diet not only eases joint inflammation, but also improves overall health and helps prevent chronic disease. It includes lots of fresh fruits and vegetables, fatty fish and seafood, extra virgin olive oil, and whole grains. It features less red meat in favor of more poultry and legumes, along with healthy nuts like almonds, walnuts, and chia seeds. Sarah's story shows how changing your food can change your life. Sarah, 70, from California, was heavily dependent on pain medications due to severe arthritis in her knees. But after a visit with a nutritionist, she decided to fully switch to a Mediterranean-style diet. Within just a few weeks, she noticed less pain and reduced swelling. Losing a few pounds also helped ease the pressure on her knees. A year later, Sarah had dropped nearly 22 pounds, and she was back to enjoying her favorite activities, gardening and walking along the beach, without needing daily pain meds. Here are some important tips for making dietary changes. Make changes gradually, as there is no need to rush. Focus on fresh whole foods and limit highly processed items. Finally, stay hydrated by aiming for at least 2 liters of water a day. So what about your weight? Did you know that even a small drop in weight can significantly ease joint pain? Keep going. Up next is a surprising truth that many people often overlook. Did you know that losing just 1 kilogram can take up to 4 kilograms of pressure off your knees every time you walk? That and the powerful discovery from researchers at Northwestern Medicine and WebMD, managing your weight is one of the simplest and fastest ways to ease pressure on your joints and reduce pain significantly. Your weight affects your joints so much because of joint pressure and inflammation. According to WebMD, for every extra kilogram you carry, your knees feel 3 to 4 times that amount in added stress when you walk. This means if you're just 5 kilogram overweight, your knees are absorbing an extra 15 to 20 kilograms of force with every step. Furthermore, fat cells don't just store excess weight, they also release inflammatory chemicals that can make arthritis pain even worse. Even a small amount of weight loss can bring big relief. A study by Northwestern Medicine showed that losing just 5 to 10% of your body weight could reduce joint pain by up to 50%. For example, if you weigh 70 kilograms, losing just 3.5 to 7 kilograms can make a major difference. In fact, Losing 11 kilograms can cut your risk of developing arthritis in half. To lose weight safely and effectively, you should combine healthy eating and light activity. Stick to an anti-inflammatory diet, like we discussed, along with gentle movements such as walking or swimming. Aim to lose weight gradually, about 0.5 to 1 kilogram per week, as this is the safest and most sustainable approach. If you are struggling, you can get professional support by talking to a nutritionist who can guide you with a personalized plan. William Jim's story is a turning point after losing 10 kilograms. William, 69, from Chicago, once thought losing weight at his age was impossible. He suffered from constant knee pain due to arthritis. But after his doctor suggested weight loss, William committed to simple diet changes and daily walks. In just 6 months, he lost 10 kilograms and the pain in his knees decreased so much he could hardly believe it. Now, William enjoys trips with his grandchildren, no longer worried about unexpected pain ruining the fun. There are a few important things to remember about weight loss. Avoid extreme or unhealthy diets, as they can do more harm than good. Be patient and stay focused on long-term health, not quick fixes. And get support from friends, family, or a healthcare provider. D makes the journey easier and more enjoyable. See how powerful weight management can be? But don't to stop here. There are still more amazing pain relief techniques waiting for you in the next section. Beyond a diet and exercise, there are several simple yet surprisingly effective techniques you can try right at home. Let's explore them together. Massage isn't just for relaxation. It also helps improve circulation, ease muscle tension, and reduce joint stiffness. According to the Arthritis Foundation, just 10 to 15 minutes of gentle massage daily on sore areas like the knees, hips, shoulders, or hands can noticeably reduce pain and improve joint mobility. You can also find relief from within through meditation and relaxation. Did you know that chronic stress can actually worsen arthritis inflammation? Mayo Clinic has shown that mindfulness techniques, such as deep breathing, gentle yoga, or meditation, can lower the stress hormone cortisol, which in turn helps reduce inflammation and joint pain. Try setting aside just 15 minutes each morning for light meditation or breathing exercises. Not only will your joints thank you, but your mood and overall outlook may brighten as well. Acu works by activating your body and natural pain relief mechanisms. A study from the Arthritis Foundation revealed that acupuncture can effectively ease arthritis pain by stimulating your body to release endorphins, your natural painkillers. To try it safely, be sure to seek care from a licensed and experienced acupuncturist. Assistive devices can be your best allies in daily life. Canes and walkers help take pressure off sore joints while boosting confidence and independence. Chairs with armrests and medical cushions make it easier and less painful to sit or stand. There are also daily living aids, like easy grip utensils and jar openers, that make everyday tasks easier for those with hand joint pain. Emma's story is a complete pain relief journey. Emma, 80, from Florida, used to struggle with daily joint pain in her fingers and knees. At first, she didn't believe that things like meditation or massage could help. But at her granddaughter's encouragement, she gave it a try. 10 minutes of light meditation each morning and gentle massage on her hands and knees before bed. Within a few weeks, Emma was sleeping better and feeling far less pain. Her spirits lifted, and she happily returned to her favorite pastimes, baking and knitting. She had given up due to arthritis in her hands. Here are some important tips for using these techniques. Be consistent and use these methods daily to see long-term results. Always consult your doctor or a qualified professional before trying something new, especially acupuncture. And finally, choose assistive tools that match your needs and level of joint pain. So, have these powerful techniques inspired you yet, or do you still have some questions left unanswered? Don't worry, in the next section, I will cover the most common concerns and give you clear, practical answers that our community members ask all the time. In this section, let's walk through some of the most common questions from the global community, shared through warm, real conversations between doctors, patients, and their loved ones. You might find yourself or someone you care about in these stories. Story number 1. But my 85-year-old mom has severe knee arthritis, but can't take anti-inflammatories. What should we do, daughter Emily? But doctor, my mom is 85 and suffers from terrible knee pain. She can take NSAIDs because of a past stomach bleed? We both tried Tylenol, 750 milligrams every 4 hours, and some topical creams, but nothing works well. Do you have any advice, doctor? But this is actually very common among seniors. When pain medications are limited, I often recommend alternating hot and cold therapy daily, and warm water exercises, gentle physical therapy at home, like light massage or meditation, can also be very effective. Have you tried any of those, Emily? Not yet, but I will start with hot-cold therapy and gentle movements right away. Thank you, doctor. Story number 2. But my mom struggles to get up from chairs or the toilet. What can I do to help her stay safe? Son, James. Doctor. My mom is 86 and has serious joint pain. She struggles to stand up from a chair or toilet, and I worry she or might fall helping her, doctor. But you should use a sturdy chair with armrests and one that's high enough for her height. You can also try using a gait belt for support while she stands or moves. If needed, consider getting help from a third person or a home care aide to ensure safety for both of you. James, but that's great advice. I will try that right away. Thank you, doctor. Story number 3. But I heard turmeric and ginger tea can help arthritis. Is it really effective? Patient, Sarah, Bandon. Doctor, I've heard that turmeric and ginger tea is good for arthritis, but I'm not sure it actually works. What do you think, doctor? But that's a great question. Turmeric contains curcumin, and ginger contains gingerol. Both are powerful natural anti-inflammatories. Many international studies have shown that drinking this tea daily for about 3 weeks can significantly ease joint pain. Just be consistent and follow the recommended doses, Sarah. But that explanation really helps. I will give it a try starting today. Story number 4. But is light exercise really good? I'm afraid moving will make my joint pain worse. Patient, Michael. Doctor, I have bad knee arthritis and worry that walking or exercising will just make it worse. Doctor, but Michael, that's a common fear. But science tells us the opposite. If you avoid movement, your muscles weaken, and that actually makes the pain and stiffness worse. Light activity, but like short walks, gentle swimming, or beginner yoga, can help a lot. Just be sure to warm up first and start slowly, Michael. But that makes me feel more confident. I would start tomorrow. Do you see yourself or a loved one in any of these stories? Just remember, you are not alone. There are gentle, effective solutions you can try right at home, no matter your age or limitations. And don't to go just yet. Zia almost at the most important part. A special message of inspiration just for you. Dear friend, you just completed an inspiring journey toward taking back control of your health, or helping someone you love do the same. Remember, arthritis is not the end of an active, joyful life. In fact, it can be the beginning of a new chapter filled with powerful knowledge and smart choices that help you live better, feel stronger, and enjoy more each day. Be like John, Emily, Olivia, William, and Emma. Ordinary people who made extraordinary changes through small, simple steps if they could do it. You absolutely can too. And herein a special gift just for you. In the next video I will be revealing the 7 golden habits for seniors to stay healthy and age graceful. These are science-backed tips that few people know. They're incredibly simple and unbelievably effective. You won't want to miss them. So be sure to hit that subscribe button and turn on notifications now to be among the first to receive these valuable health insights. By joining our community, you will always have access to the best natural, science-based, and practical solutions for yourself and your loved ones. Thank you for spending this time with me today. Always remember, your health is in your hands. I would see you in the next video.